Hello everyone, welcome to Day 9 of Windstroke webinar brought to you by Lamp AccuWellness Foundation Inc. as part of its continuing Lamp Lecture series. Today we will discuss the case history, unconsciousness, and hemiplegia. Our patient is a 39-year-old female whose main complaint is unconsciousness and hemiplegia. This patient had a long history of severe hypertension with dizziness and headache. She was prescribed appropriate Western medication but took it only occasionally. 2 days ago, while physically laboring, she suddenly lost consciousness and was admitted to the hospital while still unconscious. Her eyes were tightly closed, her jaw was tightly clenched, and her breathing was very rough with a loud gurgling sound from the throat. She had severe hemiplegia down the left side of the body. Since the onset of symptoms, she had no bowel movements. Her temperature was 38.8 degrees Celsius. Her body was very hot to the touch, and her face was red. The tongue body is deep purple and curled up as a result of increased muscular tension. The coating is thick, greasy, dry, and yellow. Because the patient was unconscious and her jaw was clenched, a special mouth gag was used to open the mouth. Pulse, slippery, wiry, and forceful. Let's analyze the symptoms. Sudden loss of consciousness indicates severe disruption of the brain, known as misting of the clear pallus, which refers to the brain. The hemiplegia is due to obstruction of the channels, the tightly closed eyes, clenched jaw, and rough breathing, obstruction of yang qi, gurgling in the throat means phlegm, red complexion, hot body surface, and constipation, heat pattern, curled tongue is due to obstruction of the channels. Deep purplish tongue represents a heat pattern. Dry yellow greasy tongue coating and slippery pulse, Phlegm-Heat. According to the five-phase theory, the liver is associated with wood, spring, and wind. In nature, the wind is characterized by movement, while spring is associated with new development, growth, and rebirth. The qualities of the liver encompass both of these aspects. For example, it is said that the liver controls the dispersal and free flowing of qi. This includes regulation of the emotions, constant readjustment to the physiological rhythms of life, and the establishment of harmony between all the yin and yang organs. Qi circulation is closely related to the circulation of blood. For this reason, the regulation of the free flow of qi by the liver also serves to regulate the blood. In addition, the liver also has a close relationship with the transformation and transportation of food and water in the middle burner. Cause of disease: wind, Phlegm-Heat. Wind is a yang pathogenic factor. Whenever wind attacks the body, the onset of disease will be very sudden, and the symptoms will always involve movement, such as muscular spasms, trembling, convulsions, dizziness. The severity and site of these symptoms may change very quickly. This patient's illness reflects a wind pattern. The unconsciousness, gurgling in the throat, yellow and greasy tongue coating, and slippery pulse all clearly indicate the presence of Phlegm-Heat. Site of disease: heart and liver. The loss of consciousness is the main indication of a heart disorder. The sudden onset of symptoms, hemiplegia, and wiry pulse indicate involvement of the liver. The patterns of internal and external wind share many characteristics. Both types of wind can have a sudden onset with changeable symptoms, and usually they attack the upper part of the body. Their origins, however, are completely different. External wind comes from the natural environment penetrating the defenses of the body through the skin. Internal or liver wind is created by an abrupt change of the yang qi of the body. There is thus no direct relationship between these two forms of wind. This patient has a history of dizziness and headache, which shows that she already had a preponderance of yang. Her present condition was caused by a sudden and dramatic rise of liver wind. Wind combined with phlegm mists the clear palace and disrupts the ascension of clear yang, leading to malnourishment of the head. The spirit therefore becomes incapable of maintaining consciousness. As a result of liver wind, the liver's main activity of promoting the free flow of qi is entirely disrupted, resulting in an imbalance between qi and blood, which causes severe stagnation. The yang qi is incapable of rising to the body surface and thus cannot maintain the activity of the sensory organs. This explains why the patient has a tightly clenched jaw and tightly closed eyes. The hemiplegia is caused by obstruction of the channels and collaterals by wind and phlegm. The circulation of lung qi is interrupted by the Phlegm-Heat in the upper burner, and consequently the patient has very rough breathing. The hot sensation of the body and the patient's red complexion are caused by the pathogenic heat rising upwards and bringing qi and blood with it. The patient is constipated not only because the general circulation of qi in the body has been thrown into chaos, but also because the pathogenic heat has consumed the fluids of the large intestine. The tongue is deep purple due to pathogenic heat which has penetrated to the blood level. The curled tongue body indicates obstruction of the channels caused by internal wind and phlegm. The stiffness and immobility of the tongue are also symptoms of a more general pattern of channel obstruction, causing malnourishment of the sinews, muscles, and vessels of the body. The dry, thick, yellow, and greasy tongue coating and slippery pulse are typical manifestations of Phlegm-Heat. The wiry nature of the pulse clearly indicates a liver disorder. Pattern of disease. Interior pattern. The internal wind was caused by an imbalance of yin and yang in the liver, which blocked the channels, misted the spirit, and interrupted the circulation of qi and blood. Heat pattern. Red complexion, hot body surface, deep purple tongue, and yellow coating all confirm the presence of heat. Excessive pattern. The main evidence for this is sudden unconsciousness, tightly closed eyes, clenched jaw, rough breathing, and wiry, slippery pulse. The great amount of phlegm has obstructed the flow of yang qi. Where did the phlegm come from? There are two possible explanations. First, the patient has chronic spleen qi deficiency. This pattern produces dampness, which can transform into phlegm if the condition persists for a long period of time. The second possibility is that the liver wind could have caused chaos within the middle burner and induced the rapid production of phlegm. Clinically, however, phlegm, no matter where it originates, will manifest in the same way. The treatment principle will therefore be the same. Is this case purely excessive? Preponderance of liver yang and the rising of liver wind are both influenced by a deficiency of kidney and liver yin. These two individual patterns are, and therefore, a combination of excess and deficiency. That is, the root of disease is deficiency, but the symptoms which characterize it are excessive. According to the 8 principles, this should be classified under a deficiency heading. But in this case, the pattern is described as excessive. The reason is that although yin deficiency is a problem, the combination of wind and phlegm heat presents a strong set of pathogenic factors. They are all excessive in nature, which causes profound stagnation of qi. Therefore, the symptoms of kidney and liver yin deficiency fade into insignificance, and the diagnosis focuses on excess as the main problem. Is there blood stasis? The patient has a deep purple tongue, which usually implies heat and blood stasis. In this case, however, the blood stasis is just a sign of the pathological changes that are occurring. The yang qi and heat have surged upwards, forcing the qi and blood upwards. They are all concentrated in the head, where stagnation occurs. This phenomenon causes a collapse in circulation, resulting in blood stasis. Which pattern of wind stroke is this? The 4 key symptoms are unconsciousness, hemiplegia, tightly closed eyes, clenched jaw, also known as trismus. The yang qi is clearly very stagnant. Hence, this is part of the closed pattern of yang organ wind stroke. Conclusion. According to the 8 principles, internal heat, excessive pattern. According to etiology, internal wind or liver wind, phlegm heat. According to organ theory, closed pattern of yang organ wind stroke, liver wind with phlegm heat misting the spirit. Treatment principle, calm the liver, extinguish the wind, remove the phlegm and heat, open the orifices. Selection of points, GV26, kidney 1, PC8, stomach 40, liver 3, 12 well points. This point prescription is divided into 2 groups. The first 5 points are punctured with a strong reducing method. The 12 well points are bled with the exception of kidney 1. Governing vessel 26 or do 26, Renzong. This point has a strong capacity to clear heat and recapture the spirit. Because the governing vessel is directly connected to the brain, the use of GV26 is indirectly instrumental in calming the liver wind by improving the level of consciousness. Renzong is located on the face at the junction of the superior third and middle third of the philtrum. Do26 is the crossing point on the do vessel with the large intestine and stomach meridians, resuscitates, treats acute lumbar sprain, and benefits the nose. Do26 is used for emergency treatment, needling, oblique insertion, upwards, 0.3 to 0.5 Sun. Kidney 1, Yungchen. This is the well point of the foot lesser yin channel. It has a good capacity to clear heat and remove obstruction from the brain and sensory organs, thus assisting in recapturing the spirit. Kidney 1, Yungchen, is located on the sole in the depression when the foot is in plantar flexion, approximately at the anterior third and the posterior 2/3 of the line from the web between the second and third toes to the back of the heel. Kidney 1 is Jingwell point of the kidney meridian. Descends excess above, resuscitates, clears heat, calms the shen, tonifies yin, clears empty heat. Kidney 1 is an excellent point to subdue excess liver yang, wind, and or fire. Jingwell points are where the qi bubbles up. Jingwell points are indicated to revive consciousness. Jingwell points are known to treat fullness below the heart and clear heat. Needling, perpendicular insertion, 0.5 to 1 Sun. Pericardium 8, Lao Kung. This is the spring point of the hand terminal yin channel. It has a very strong effect on heat. which is disturbing the spirit. This point supports the function of GV26 and kidney 1. Pericardium 8, Laukung, in the center of the palm between the second and third metacarpal bones, closer to the third metacarpal bone. When a fist is made, the point is where the tip of the middle finger touches. PC8 is yin spring point of the pericardium meridian. Clears heart heat, calms the shen. Pericardium 8 is the best point to clear heart fire. Yin spring points are where the qi dribbles down the meridian. Yin spring points are indicated for heat in the body and changes in the complexion. Yin spring points are known to clear heat from the meridian. Needling, perpendicular insertion, 0.3 to 0.5 Tsun. Stomach 40, Feng Lung, is the connecting point of the foot yang brightness channel. It resolves phlegm and removes turbid yin or waste from the body. Moreover, this point assists in regulating the flow of qi in the middle burner, thus helping to unblock the bowels. Stomach 40, Feng Lung, is on the anterior aspect of the lower leg, 8 Tsun superior to the external malleolus, lateral to stomach 38, 2 finger breadths, using the middle finger from the anterior crest of the tibia. Stomach 40 is the connecting point of the stomach meridian. Transforms phlegm and dampness, stops cough and wheezing, calms the shen, and clears phlegm from the heart, activates the meridian, and stops pain. Stomach 40 is known as the phlegm point. It helps resolve phlegm throughout the body. The connecting points of one meridian can communicate with 2 meridians. They treat diseases of the collaterals and can be used to treat chronic diseases, especially chronic diseases of the Zangfu organs. Clinically, the connecting points are often combined with yuan source points in the treatment of diseases. Needling, perpendicular insertion, 1 to 1.5 Tsun. Liver 3, Tai Chung, calms the liver wind and clears heat, and is used here with a strong reducing method. It is a distant lower point and is a good combination with GV26. Liver 3, Tai Chung, is located on the dorsum of the foot in the depression proximal to the first metatarsal space. Yuan source point of the liver meridian and shoestring point of the liver meridian. Liver 3 regulates liver qi, subdues liver yang, regulates menstruation, calms the shen, nourishes liver yin. Liver 3 is a very important and commonly used point. It is often coupled with Li4, known as the 4 gates, to effectively move qi and blood throughout the body. Clinically, yuan source points are of great significance in treating diseases of the internal organs. Yuan source points are the sites where the yuan or primary qi of the Zangfu organs passes and stays. Puncturing the yuan source points stimulates the vital energy of the regular meridians, regulates the functional activities of the internal organs, reinforces anti-pathogenic factors, and eliminates pathogenic factors. This method of treating diseases deals principally with the root causes. The yuan source point from the affected meridian is often combined with the Lu connecting point of the internally-externally related meridians in use. Shoestring points are where the qi starts to pour down the meridian. They are known to alleviate heaviness and pain in the joints. On yin meridians, shoestring points are identical to the actions of yuan source points. Needling, perpendicular insertion, 0.5 to 0.8 Tsun. The second group of points are the 12 well points. The bleeding method is used to remove obstruction from the flow of qi and blood in the channels. GV26, kidney 1, pericardium 8. These are points that clear the head and recapture the spirit. They are all located in very sensitive areas of the body, thus the needling sensation is very strong. Clinically, this combination is mainly used for the excessive pattern of unconsciousness. In addition, this combination includes one well point, and one spring point, which work together synergistically to reduce heat. This patient was treated twice on the first day. Conventional emergency treatment was also given at the same time. After one day, the tension in the patient was visibly reduced. The following day, the patient was mentally clear, but the hemiplegia showed no signs of improvement. The treatment was then changed to one which mainly removed obstruction from the channels and collaterals. GV20, LI11, TB5, GB34, stomach 40, GB39. 220 or GV20 by way. On the head, 5 tsum directly above the midpoint of the anterior hairline, or at the midpoint of the line connecting the apices of the two auricles. Do20 is crossing point on the do vessel with the 6 yang meridians, C of marrow point. Do20 raises yang, treats prolapse, subdues yang, clears the head, calms the shen, dispels interior wind. Needling, subcutaneous insertion, 0.5 to 0.8 tsum. LI11, T2. With the elbow flexed, the point is on the lateral end of the transverse cubital crease, at the midpoint between lung 5 and the lateral epicondyle of the humerus. LI11 is hisi point of the large intestine meridian. Clears heat, cools blood, resolves dampness, expels exterior wind, regulates qi and blood, activates meridian, relieves itching. Hisi points are where the qi of the meridian collects and goes deep into the body. Hisi points treat rebellious qi and diarrhea. Needling, perpendicular insertion, 1 to 1.5 tsum. Sanjiao 5 or triple burner 5. Y, Quan. On the dorsal aspect of the forearm, on the line connecting SJ4 and the tip of the elbow, 2 tsum above the transverse crease of the wrist between the ulna and radius. Sanjiao 5 is loop connecting point of the Sanjiao meridian, master point of the yang wei vessel coupled with GB41. Dispels wind heat, releases the exterior, benefits the ears, activates the meridian, alleviates pain. SJ5 is a very important point to use for releasing exterior wind heat. Loop connecting points of one meridian can communicate with two meridians. They treat diseases of the collaterals and can be used to treat chronic diseases, especially chronic diseases of the Zhangfu organs. Clinically, loop connecting points are often combined with yuan source points in the treatment of diseases. Needling, perpendicular insertion, 0.5 to 1 tsum. Gallbladder 34. Yang Ling Chuan. On the lateral aspect of the lower leg, in the depression, anterior and inferior to the head of the fibula. Hisi point of the gallbladder meridian, converging point of sinews. Gallbladder 34 benefits the sinews and joints, activates the meridian, moves liver qi, harmonizes the shao yang, relieves pain. Gallbladder 34 is a very good point to move liver qi and to treat anything related to the sinews. Needling, perpendicular insertion, 1 to 1.5 tsum. Stomach 40, Feng Lung, loop connecting point of the stomach meridian. Gallbladder 39, Shenzhong, on the lateral aspect of the lower leg, 3 tsum above the tip of the external malleolus on the anterior border of the fibula. Converging point of the marrow. Strengthens the sinews and bones, nourishes marrow, activates the meridian, dispels wind dampness, relieves neck pain, relieves pain. Needling, perpendicular insertion, 1 to 1.5 tsum. After 10 subsequent treatments, the muscular strength started to recover. 2 weeks later, she could stand up with the support of a stick. 40 days after onset, the patient could walk with a stick. After discharge from the hospital, the patient continued to receive acupuncture treatment 2 to 3 times a week. Even though the rate of change slowed significantly after 6 months, she continued treatment for another 18 months. During this time, she was able to take care of herself and perform the activities of daily life. However, she still required a walking stick and her memory never recovered completely. Thank you very much for your attention.